There seems to be many acronyms used, such as LGBT, LGBTQIA+. Which acronym is more reflective, or accepted by the LGBTQIA community, and what does each letter stand for?
LGBTQIA is the most preferred and accepted acronym currently, and the plus at the end is inclusive of people that are possibly not in the acronym. The L stands for lesbian, the G stands for gay, the B stands for bisexual, T for transgender, Q for queer or questioning, I for intersex, and A for allied.
We do education and advocacy for gay, lesbian, bisexual, transgender, intersex, queer questioning, two-spirit, same-gender loving, pansexual, flexual, not straight, not labeling, straight-ish, straight so far, straight with options, straight but stuff happens. Gender bending, bigender, pangender, agender, asexual, non-binary, and other sexual and gender minority youth. As you can tell, there's a lot of words. Fortunately, I think that what's most true about all of this stuff is that you need to know the basics, but once you know the basics, all you have to do is keep open rather than keep up. Right? We can't keep up. The words are always changing, but we can keep open and listen to what people say and respond to what people are telling us.
So emails sometimes have pronouns next to the person's signature. To name a few: she, her, hers, they, them, theirs. What do they mean?
Some people do it as a sign of solidarity for transgender people, that we all should utilize, our pronouns because we all have them. I think it often avoids miscommunications and mistakes. I think for trans people, it's something that we can do to let people know that is the pronoun that we use before they even meet us. When people come in to meet me, sometimes it's hard to tell what pronouns somebody uses, right? You can't tell on the phone what pronouns I use. You can't even tell sometimes coming in and looking at me necessarily what pronouns I use. They're easily accessible on the internet. I think that probably the only ones that, aside from for gender neutral people or non-binary people, might use they, their pronouns or ze, their pronouns. Or my favorite is fey, fair, because I'm like a radical fairy kind of person. So, I think there's a whole list of gender neutral pronouns that are out there if you're looking.
People are always wondering about pronouns and what's the right pronouns and how do you ask about pronouns and all those kinds of things. So what a lot of people are doing right now is putting their pronouns at the base of their email signature as a message to people that you've thought about this, that you know what it means, and that you're open to hearing other people's pronouns. The fastest growing identities, especially for young people and young adults, is an identity that's called non-binary. So neither male nor female, but something more or different than that. I've had young people say to me things like, I've always known that I'm not a girl. But just because I'm not a girl doesn't mean I'm automatically a boy, right? And so for people who don't identify as either male or female, he or she doesn't work as a pronoun. And the most common pronoun that people are using now is they, them, and theirs as an individual pronoun.
There are other pronouns that people use. Another common one might be ze, zer. People sometimes use that instead of they, them pronouns.
How should we ask anyone that we are interviewing on how they should be addressed?
I really appreciate that question because we talk a lot about what it means to be person-centered. And I guess what I'd say about that is ask anyone with whom we have contact what their preferences are. Starting there, it's a pretty simple thing, but it is a respectful way to start any kind of conversation. And because we're in service, I think that that's always advisable.
The best way to ask people how they want to be identified would be to introduce yourself first with your pronouns, and then ask, what are your pronouns?
If it's a stranger and somebody I don't know, sometimes I'll say, or a new patient, I'll sit down and I'll say, hi, I'm Dr. Demadon. I use she, her pronouns. Do you have a preference of pronouns for me?
Sometimes you'll hear people say that if you don't know, ask. I have a problem with that as a strategy because if the only people we're asking are the people that we wonder about, then we're using some sort of a stereotype to decide who to ask. So we need to figure out a way to ask everybody, because especially with non-binary folks, that what you see, how people dress and express, may or may not reflect who they are and what their internal identity is. So we have to figure out a way to ask everybody on intake. And the easiest way is to use open-ended questions in the beginning of your intake process. So you'll say, I noticed that your legal name is this. Is there a name that you prefer that I use? So trans folks or people for whom the name on the birth certificate doesn't relate to who they are can offer an alternative. But there's also lots of people who use nicknames. People may want you to say their name correctly, right? And so asking them, how would you like to be addressed? And then following up with, my pronouns are she, her, and hers. What are your pronouns? People who've thought about this, they're going to go, wow, thanks. My pronouns are this. For people who've never thought about this and haven't been asked about their pronouns since 3rd grade, they're going to say, what? And so then it becomes a teachable moment that you say, well, we don't make assumptions about anybody's identities here. So we ask everybody about their pronouns.
What should we do if someone has introduced themselves with their pronouns, but we make a mistake?
So you have a little bit of flexibility, because it's going to take a minute to wrap your mind around a new language that you didn't grow up experiencing. If you make a mistake, notice, correct yourself, apologize, and move on.
I mean, I think it's sort of like any other mistake that somebody would make. You just apologize for it. I think, I think that the sheer apology for it to a trans or gender nonconforming person is great, that you're acknowledging that you made a mistake and that you're going to try to correct the behavior. However you need to do that to make sure that you don't do it again, that would be what I would focus on.
The best thing to do in that case would be to acknowledge that you've misgendered them by using the wrong pronoun, own it, and then move forward.
What is the difference between sexual orientation and gender identity?
When I do any trainings, I tell people, if you learn nothing else from this training, this is what I want you to learn. Sexual orientation, the way that I look at it is it's who you go to bed with, okay? Gender identity is who you go to bed as, all right? So sexual orientation develops in our teens, right? Or maybe in our late childhood, and it's a attraction to somebody else, whether it's emotional or physical attraction to somebody else. Sexual orientation has nothing to do with gender identity at all. The label may have something to do with what gender you are, but gender identity is not associated with sexual orientation in any way. Remember, I don't need to give you a pill to make you gay. I don't need to give you a shot to affirm your lesbianism. Most transgender people do require some sort of medical affirmation or treatment. That's why that population of people, we need to have a better understanding. More people need to have a better understanding of why gender identity is so important to be protected in medical spaces.
Gender expression is the outside communication of our identities. Sometimes it matches our internal identities and sometimes it doesn't, right? But it's what the world sees when it looks at us. Gender identity is about who you know yourself to be as a boy, a girl, a man, a woman, or something more or different than that.
How can we help to foster an inclusive and comfortable environment for LGBTQIA+ employees and individuals we serve?
The best way to make sure that everybody, employee as well as client, understands its inclusive environment is by the messages and cues and clues that are being sent all around. So you have messaging done all the time in your environment. You might have flags that are rainbow flags or transgender flags. You might have pins that people wear that say pronouns or might have those flags as well. There's messaging going on with pictures and images around. There's also messaging done in communication on your website through communication with employees and with clients.